Good evening and welcome to our first workshop in a series of 6 workshops on hypertension. I wanted to introduce myself. My name is Jenny Waldo and I'm the public health nurse here in Windsor. I wanted to let you know that many of you have scheduled for all 6 workshops, which will occur every Monday evening or every other Monday evening at 6:30 between this evening and Monday, June 6th, and hope that you can join us for all of those. Tonight, we have started the workshop and it will be recorded and placed on the Town of Windsor website if there's any questions and you'd like to watch the recording of that. We will tape this presentation. At the end of the presentation, we will stop recording for question and answers. Wanted to remind you that this is an educational workshop and the question and answer is not intended to be an individual consultation on your specific healthcare. At the conclusion of the question and answer, we will do a demonstration on the use of the self-monitoring device. If you have needed one and have had difficulty getting one, please reach out to me as we have some available for those who've had some difficulty. Following the presentation, we ask that you complete the evaluation as well as the pre-diabetes risk form. That information looks like, oh, it's difficult to see from here, but you will find that on the website as well as the evaluation that you can print, complete, and then return to me. And you will receive $5 gift cards each time those are returned. That'll be done at the conclusion of the workshops in June. Wanted to remind you that I only need to get 1 copy of the pre-diabetes risk assessment. You do not need to do that each time you attend the workshop. And I think that wraps up my comments. Again, we are happy to have you here. And I'm going to turn it over to Dr. Mirza, who will be doing the presentation tonight on blood pressure classifications and the importance of adherence.
All right, Jenny, thank you very much for your invitation. And we did this last year also, and we'll be doing this again this year. And I hope that people are getting some benefit out of these lectures because hypertension is one of the very prevalent. So if you can please show the slides. So my name is Atiq Mirza. I'm board certified for nuclear cardiology, general cardiology, and non-invasive cardiology. I work with my 10 other colleagues at Central Connecticut Cardiologist, which is a private practice. And I'm also have affiliation with Quinnipiac University for their Frank H. Netter Med School, and also at University of Connecticut Med School to teach their students and the trainees in cardiology and internal medicine. So if you can please help me, this is not moving the, if I can have the, it's still not. We're sorry for the technical delay. We'll be, as soon as we get the slides ready, we will. Okay, so today what we'll be doing, we will talk about high blood pressure, what high blood pressure is, what is its definition, how do we classify, classification, what is the normal or abnormal blood pressure, how prevalent is this high blood pressure problem, what are the risk factors which are involved in the development of high blood pressure, and how high blood pressure affect in mortality and morbidity. And then a little bit, we will talk about some management of high blood pressure. So, as most of you already may have some idea what blood pressure is, if you have ever thought about the heart, heart is a muscular organ and has 4 chambers. And if you have ever touched the live wire in your life, you may know that when current flows through your body, the muscles, especially skeletal muscles, they go into spasm. The same thing happens in your heart muscle. Every 60 to 90 times, current is generated in your heart, and that leads from the right upper chamber, starts from the right upper chamber, goes to the 2 top chambers, and then rest in between the two top and two bottom chambers for a few milliseconds, and then goes down to the bottom chambers. And then wherever the current flows through in your heart, that area of the heart goes into spasm. And as the heart is a pouch-shaped muscle, so when it goes through the different parts of the heart, when they squeeze, that causes the pumping of the blood out of that chamber. So the blood pressure which we usually measure, that is a pressure of your left lower chamber of the heart. We call it left ventricle. And that top number you usually see is the pressure in the bottom chamber of your heart when the bottom chamber of your heart is pumping or squeezing. And the bottom number of your blood pressure is when that chamber is relaxing. So the pressure doesn't go to zero or normalize the pressure. It only decreases a little bit between each relaxation and each compression. And then blood goes through all your different kinds of arteries, which some are muscular arteries, some are small arterioles and capillaries, and some are the big arteries, which are elastic. So this is how the pressure is submitted or transmitted through your left-sided heart to the whole body circulation system. As explained earlier, top number, which is a bigger number, which is the pressure in the left lower chamber of the heart when the heart muscle is pumping or squeezing. And the bottom number, which normally is around 80, is the number when the heart is relaxing. So this is why we call it systolic and diastolic. Pumping is systole and relaxation is diastole. So how do we measure it? What should we do to measure the blood pressure? So most of you have these measuring apparatuses which you have bought from different stores or have been given to you from doctors' offices, or Windsor has also given this to the community members. So always put it on the bare skin. Don't put it on your shirt or a sweater, or that doesn't give you the accurate reading. Then before you check your blood pressure, take some few deep breaths, sit down, relax before you check it, or push the button to record your blood pressure. And usually it's recommended to stay quiet between the machine when it's checking the blood pressure. Place your feet flat on the floor and sit up straight, and keep your arm at your chest level where your heart is. And it's not recommended to check your blood pressure in a very cold room. That may not give you the accurate number. So measure your blood pressure at different times of the day, because that will give you the different ranges and variety. And also try not to smoke or drink 30 minutes before taking your blood pressure. And always make sure that your bladder is empty before you take your blood pressure. So these are the few points which we all need to remember when we check our blood pressure. So as we talked about it earlier, we always be having two numbers whenever we talk about the blood pressure. The first top number is the pressure when your left ventricle is squeezing or pumping, and then that is transmitted to your artery which runs in your arm. So the pressure. So usually in good old days, how did we find it out? Why this 120 number was picked up? So this is how much millimeter of the mercury was raised by one squeeze of the left ventricle. And the same way, when the heart relaxes, it raises mercury bar up to 80 millimeter of mercury. So top number is the systolic blood pressure when the heart pumps blood out, and the diastolic blood pressure is when heart relaxes to receive the blood from the lungs. So this is the classification which we all need to know. Normal blood pressure is considered 120 over 80 or less. There are some concepts which were valid previously that, older people should have high blood pressure, younger people should have, this number is good for the younger people. But now we know these numbers are good for most of us, unless there are some specific conditions are involved. If your blood pressure is between 120 over 29, the top number, and the bottom number is still less than 80, that's considered an elevated blood pressure. And if the blood pressure top number is between 130 to 139, and the bottom number is between 80 to 89, that's considered stage 1 hypertension. And if you can see on the screen, these are green, yellow, and orange. The next is bright red, and that is if your blood pressure is above 140 over 90, that is stage 2 hypertension. And then if your blood pressure is higher than 180, the top number, and the bottom number is higher than 120, that is called hypertensive crisis, which can be divided into urgency and emergency. And we have a full lecture and we'll full talk about that. Maybe my third or second talk will be about that. We will talk about it. So if you look at this chart, you can see that normal blood pressure 120 over 80 or less, 120 to 29 is elevated, 130 to 139 is stage 1, and above 140 is stage 2. And we need to make sure if we are not taking the medications, our number should stay in green. If we are taking the medications, medications should be taken, and then to maintain the blood pressure in green with the medications. So those who have hypertension, they still have the same number with the medications, which is called normal, 120 over 80. And those who do not take the medications for them also, unless there are other very rare situations are involved. So as I said, that what is hypertensive urgency, which we will discuss in detail in another lecture, but just for the curiosity, urgency is when blood pressure is high, 180 or 180 over 120 or above, without someone having any symptoms. You didn't feel any bad, you didn't have any other symptoms, you went to your doctor's office, or you went to any local store, or you checked your blood pressure at home and your blood pressure was above 180 over 120. And you didn't have any symptoms associated with it. And that is called hypertensive urgency. At the same time, hypertensive emergency means that blood pressure is above 180 over 120, but you are having some symptoms, which can be, but not limited to these symptoms: chest pain, shortness of breath, back pain, numbness, tingling sensation, weakness, blurry vision, or other changes in the vision, or having difficulty to speak. So hypertensive urgency is high blood pressure above 180 over 120 without symptoms. Hypertensive emergency is high blood pressure above 180 over 120 with symptoms. And treatment for both is call your doctor right away, especially for hypertensive emergency, go to the emergency room by calling 911. Now, last night I was looking for this prevalence of hypertension 2000 in US adults age 20 or above. And as this slide was there in my last talk also, so I could not find any new data available, because there was one data available from 2018, which was not very different from this. But this summarized it in a very beautiful chart, giving us the map which states have, the percentage of high blood pressure. If you look at very pale pink, the first one, the age-adjusted hypertension prevalence is around 24 to 27%. If you look at the orange one, the prevalence goes up to 27 to 28%. If you look at the dark orange one, it goes to 28.3 to 30%. Red goes up to 30 to 31%, whereas dark red is 32 to 38%. So if we look at Connecticut, we luckily have a very low hypertension prevalence in our state. And if we look at the difference between men and women. We are still lucky that in state of Connecticut, in women, as compared to USA as a whole country, our prevalence of high blood pressure is lower in dark pink, whereas the whole country is higher than us, around little above 30%. Whereas in men, again, we are very lucky that our men have less prevalence of high blood pressure as compared to the rest of the country, although difference is not that much. So again, we can divide it by the age and the ethnicity. So if we look at the age between 18 and 44, Connecticut prevalence is around 12.6%. The country stands at 14.1%. If we go a little above that age between 45 and 64, Connecticut is at 35%, whereas US stands at 40.5%. People who are aged above 65, their Connecticut prevalence is in 59.2%, whereas the country's prevalence is at 60.5%. If we break this data into race and ethnicity, in Connecticut, American Indian and Alaskans, if we include them, the prevalence is higher in Connecticut as compared to the rest of the state country, where we are at 44 and the country is at 38.8%. If we look at the Asian Americans, Connecticut prevalence of blood pressure is around 16.5%, and rest of the country is around 20%. If we look at our Black population, we are again at 36%, whereas country is around 41%. In Hispanics, again, we are above the rest of the country, although not with a huge margin, but it's 24.5% here as compared to the rest of the country is around 24%. Again, if we break it down according to the education, those who are high school grads in Connecticut, their blood pressure prevalence is lower as compared to the rest of the country. Those who have some college, there's a very slight margin on the higher side in Connecticut as compared to the rest of the country. Those who are college grads, again, we are better than the rest of the country, but not with a huge margin. And those who have less than high school, again, difference is not that much as compared to the rest of the country. And if we divide this data into according to the different income categories, those who earn less than 25,000, they're almost at the same with the rest of the country. Those who earn between 25 and 49 plus thousands, there's also almost the same, 36 versus 37%. Those who are between 50 and 74,000 or plus, again, it's the same, around 34 and 34%. Those who earn more than 75,000, again, difference is not that much. 27% for those in Connecticut, and rest of the country is at 28.5%. So the reason to break down this data into different categories was just to familiarize all of you that although we are doing slightly better than the rest of the country, but this difference is not huge. Whatever way you break it, whether you take the income, education, ethnicity, or color, or whatever way you want to divide this or analyze this data, the result is not much difference than the whole country. So in women, especially when we look at it, so as I mentioned earlier, total prevalence is around 30.5%. And usually males have higher blood pressure as compared to the females. This is shown in different counties. So is it possible to remove this so that I can look at the rest of the slides, sidebar? Okay. I'm sorry for this little glitch. So this is in different counties of Connecticut. If we look at this, then Litchfield, Hartford, Toland. So difference is that the women have less prevalence as the men, but there's some difference, but not a huge difference if we look at this chart. When we analyze the cost of high blood pressure treatment, including inpatient, outpatient, the prescription use, and the emergency room visits, and we can see that the difference, the people who have high blood pressure are in blue, and those who have no hypertension are in brown. So inpatient. So this is with whatever problem you go for in the hospital, or to see the doctor as an outpatient, or to get the prescription, or you go to the emergency room. So all those who have high blood pressure, their treatment, their inpatient expense, their outpatient expense, their prescription expense, their ER visit expense, they all are higher than those when we compare with those people who have no high blood pressure. Now, let's change the gear a little bit and see what causes, why are people having this high blood pressure? So we can easily divide these risk factors of having high blood pressure into two categories. One is non-modifiable risk, means that you can't do anything about it. And one is modifiable risk, means that you have some control on it. So amongst the non-modifiable risk factors, these are genetics, family history of having blood pressure. So this is something I jokingly tell my patients, you can't go back and change your parents. Then the ethnicity, your race. African Americans have higher blood pressures, Asians have higher blood pressure, Middle Eastern heritage people also have higher blood pressure. And third is your age, which we have no control on. If I have it, I'll go back to my 16 years of age and have less medical issues in my life as compared to age higher than that. So anyone who is above 35 years or older also are at a higher risk of developing high blood pressure. Now let's talk about those modifiable risk factors. What are the modifiable risk factors? Modifiable risk factors are smoking. Those who smoke have a high blood pressure. Those who use high salt or sodium in their diet or have more processed food will have a higher tendency to have a higher blood pressure. Excessive alcohol consumption, being overweight or obese. Women who are using birth control pills also have a higher tendency to have higher blood pressure. People who are not physically active, pregnant women, and people who have a stressful lifestyle. They all have high tendency of developing high blood pressure, but this is the list of all those things which are in our control and we can manipulate it. Now let's talk about alcohol consumption. For every 100 grams or more of alcohol utilized per week, the risk of fatal hypertensive disease increases by 24%. And the graph is right here on the left, and it goes very steep upward with the increase in relative risk as the amount of alcohol increases. This is how smoking can impact the high blood pressure. And how it does it? It increases the sympathetic stimulation. Tobacco smoke, when is inhaled and absorbed in your blood, it constricts the blood vessels. Carbon monoxide present in the smoke, but when is inhaled, it decreases the oxygen supply to the heart muscle because it does not let oxygen to bind with the hemoglobin in presence of carbon monoxide. It increases your heart rate and it increases the clot formation in your blood. So with the first few puffs of smoke, the blood pressure rises from 10 to 15%, and heart rate rises about 30% during the first 10 minutes of smoke. So this is how smoking affects your blood pressure. And then what is the impact of high blood pressure on your heart? So on my left, you are seeing a cross section of a normal heart. You can see my left is, if you look at it, and in this picture, the right lower chamber is the left lower chamber of the heart. It's just that, you're facing me and I'm looking at your heart. So you see that is the only thick chamber. Rest of the walls are not as thick. But in the middle, if you look at it, all the walls are very thick. And this is the heart of a person who has high blood pressure. And this is just equivalent to that. If you keep lifting your weights, you form these dumbbell muscles. Same way, when heart keeps pumping against a high blood pressure, which is not treated, the heart muscle starts hypertrophying and becomes very thick. And third picture on your right is another cross section of the heart showing that heart muscle become very thick and heart contractions get impaired if blood pressure goes uncontrolled without treatment. And the picture on the right, this is called left ventricular hypertrophy, or picture in the middle, the same. And this is seen in 25% of the people who have high blood pressure. Now, what are the risks involved when the blood pressure is not controlled? What can happen to a person if we don't control the blood pressure? So, stroke is one of the major risks involved with uncontrolled hypertension, which includes loss of consciousness or memory loss or power loss in any part of your limb. So 50% strokes happen in hypertensive patients. Again, other cardiovascular diseases in which heart attack is at number one, hypertrophy of the heart muscle, which I showed you earlier, heart failure, which is a sequelae of having hypertrophic heart, or after the heart attack, the pumping power of the heart goes down. Then angina, which is the problem of the circulation of the heart muscle, that's also is a risk of having uncontrolled high blood pressure. Then the erectile dysfunction is also considered one of major risk of having uncontrolled blood pressure. People can lose kidney function if blood pressure is not controlled. Your aorta, the main vessel which is coming from your heart, which supplies the blood to the whole body, that can also form a tear and result in dissection. A similar way, when there is an aneurysm and it ruptures, dissection can also rupture and can cause sudden death. Pulmonary edema, or the fluid in the lungs, that's another. If the heart is not pumping well because of the high blood pressure, there'll be a backlog of the fluid, which will fill your lungs with the fluid. That's called pulmonary edema, leading to severe shortness of breath, not able to breathe. And that's, people usually go to the emergency room for those problems and don't know why it's happening, because uncontrolled blood pressure is mostly a silent process, and we call it a silent killer also. Then eclampsia, a pregnant woman can develop seizing disorder due to uncontrolled blood pressure, and loss of eyesight is another significant risk involved with uncontrolled blood pressure. And so just to summarize, stroke, heart failure, sexual dysfunction, visual loss, heart attack, kidney disease, these are all comorbid conditions which can happen if blood pressure is not controlled. Now, this is a very interesting bar diagram, or my chart. So those who have high blood pressure, their aging process is faster as compared to those who do not have high blood pressure. So this data has been divided into men and women. the gray bar shows that this population have no high blood pressure. Yellow is the one as we were discussing the classification, this comes in stage 1 hypertension, and the red comes in stage 2 hypertension. So the age should be right there at where the gray bar is, but people of the same age with hypertension, their aging will be 20 times more as compared to non-hypertensive in men, and almost the same or a little higher in women. So aging process also becomes very fast, those who have high blood pressure. So then why it's important to lower it? First of all and foremost, all the risks I explained to prevent those risks involved with high blood pressure. But we know, and we have done studies multiple times, that if we decrease only 10 millimeters of blood pressure, I'm talking about the systolic blood pressure. If your blood pressure is running 140 or 150, if we bring it down only 10 millimeter, you will reduce your risk of coronary artery disease by 20%, stroke by 27%, heart failure by 28%, and all-cause mortality by 13%. So just by lowering 10 millimeters of mercury of your blood pressure, you are able to lower somewhere between 13 to 28% of these serious comorbid conditions. Again, this chart tells us that as the blood pressure rises, the mortality rises with it. On my left, blood pressure of 120 over 80, mortality risk is very low. You keep moving to the right, 140 over 90, 160 over 100, 180 over 110, the risk gets exponentially high with the higher blood pressure for death. So that's why it's important for us to lower our blood pressure. Now, next two slides, we will like to know what the treatment of this blood pressure is. Yeah, everyone knows medicines, but there's some more to it. So let's talk about it. First and foremost is the lifestyle changes. And some of these handouts are posted by the Town of Windsor on their websites, and you can contact the Town of Windsor and they can provide you the copies if you are interested. So lifestyle changes for lowering blood pressure. Activity, increase the activity, get moving with regular physical activity. Focus on nutrition by making healthy food choices and minding your portion sizes and doing some calorie control, cutting down the salt intake. One should aim for 1,500 milligram of sodium per day or less. Take your medications on time and regular. Keep a tab on your blood pressure, check it regular. Losing weight is another way to control your blood pressure. Losing just 10 pounds can make a big difference in your blood pressure. Cut back your alcohol intake and do not smoke, because as I explained earlier, these are the two most prominent modifiable risk factors. Then de-stressing yourself, sleeping well. It's hard to easy to say than done, but again, in this day and age with pandemic and all other stresses around us, it's not easy. But de-stressing, finding 15 minutes of meditation time in a day in a corner where no cell phones, no TVs, no radios, no ringers are there, and then do some meditation and try to do some sleep hygiene to sleep well at night. That also helps in controlling the blood pressure and this all is included in your lifestyle changes. So let's take exercise. Most of us, try to do exercise, but do not know what kind of exercise one should do to control the blood pressure. As a general goal, at least 30 minutes of moderate exercise activity every day one should do. And if you want to lose weight, or maintain weight or meet specific fitness goals, you may exceed that exercise time. Moderate aerobic exercise, which includes brisk walking, swimming, or mowing of the lawn. So this is what moderate exercise is. Whereas vigorous exercise, which can be done for better cardiovascular health and losing weight, which includes your aerobic dancing, running, and vigorous aerobic exercise. Then comes the strengthening exercise. You can use some weight machines, your own body weight, resistant, tubing, stretch exercises, the resistant paddles in the water, or other activities like rock climbing and things like that. So these kinds of exercises are helpful to maintain or lower your blood pressure. As I explained earlier, aerobic exercise is the one which lower your blood pressure. Again, I will repeat. What does it include? Walking, jogging, jumping rope, bicycling, stationary or outdoor. Not necessary that we have to, in this today's weather, which is in teens, I think doing a stationary bike is an excellent idea. Cross-country skiing, skating, rowing, high or low impact aerobics, swimming, and water aerobics. They all come in your aerobic exercise, helping to control your blood pressure. So now, how much one should do? It all depends what the goals are. Aerobic exercise, at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous aerobic exercise a week. Yeah, that's more than enough. The guidelines suggest that if you spread out this exercise during the course of a week, that is the way to go, preferably, because doing all this exercise over the weekend in 1 to 2 days may not be as helpful as if you spread it out over the whole week. Then again, the strengthening exercise also be done in the same way, stretching them over the days, not doing on a short span of time. This is the most important slide, I feel, for those who have no blood pressure or who have blood pressure. If they follow this diet, those who don't have blood pressure, chances of them developing blood pressure is low. And those who have high blood pressure, if they follow this DASH diet, which is also called dietary approaches to stop hypertension. This diet is proven effective in multiple studies to control and reduce the blood pressure. What does it include? Fruits, vegetables, low-fat dairy foods, portion control, less foods that are high in saturated fats, cholesterol, trans fats, whole grain foods, and fish, poultry, and nuts. So fish, poultry, nuts, whole grain foods, foods low in cholesterol, saturated fats, and trans fats. This is part of the DASH diet. Again, low sodium, low sweets, low sugary drinks, and less of the red meat. In research studies, we have seen that people who are on DASH diet lowered their blood pressure within 2 weeks of following this diet strictly. So this is one of the best non-medicinal way to control the blood pressure. But again, if this does not work, please consider taking medications. And if you're taking the medications, you can use this diet in addition to your medications. So again, it includes 6 to 8 servings of grains daily, meats, poultry, and fish, 6 or less, vegetables 4 or 5 servings, fruits 4 or 5 daily, low fat or fat-free dairy products 2 to 3 a day, fats and oils 2 to 3 a day. Sodium, again, as I mentioned earlier, preferably keep it less than 1500 milligram, but you can go up to 2300 milligram, but again, 1500 milligram is less, and that is very hard to achieve. Same way, nuts and seeds and dry beans and peas, 4 to 5 servings, and sweets, 5 or less. So this is what, all DASH diet is all about. Now, if we talk about the medications, which we will be discussing this in another lecture also, but I just wanted to give an overview There are various classes of medications available for controlling of hypertension. And those are angiotensin converting enzyme inhibitors. These are the medications, if those of you who take the medications will know these captopril, lisinopril, ramipril, these are all the angiotensin converting enzyme inhibitors. Angiotensin 2 receptor blockers, these are the ARBs. You might have already known losartan or valsartan. These are the medications that are called ARBs. Then diuretics, some of you may take furosemide or hydrochlorothiazide or chlorothalidone. Then the beta blockers like metoprolol, atenolol, your carvedilol. Then the calcium channel blockers, which are verapamil, amlodipine, diltiazem, alpha blockers, alpha agonists, renin inhibitors, and then combination of medications. But again, on average, a person needs 3 medicines to control the blood pressure in an effective long-term way. So what it boils down to, a healthy lifestyle, and it has to be a family event. Your heart health is in your hands. Especially, you can work on your, control your blood pressure without medicines. And if it's still very high with non-medicinal ways, then you have to use the medications. But you got to be physically active, hydrate yourself by drinking more water, eat healthy, control other comorbid conditions like diabetes, high cholesterol, cut down your sugar intake, salt intake. Please stop smoking. Maintain a healthy weight, body mass index between 20 and 25 kilogram per meter square. De-stress your life. Stay positive. Glass is always half full. And give yourself credit if you do any of these things. Thank you very much. This was a little brief introduction to the hypertension, the classifications, the risk factors, what can happen if we don't control it, which organs are affected, and how we can control this with the medicines and the non-medicinal ways. I appreciate your time and thank you very much. And now we are going to stop recording this and go to the question answer sessions. So please feel free to ask your questions and we'll be happy to answer your questions. And after this, we will go to recorded section again, and Jenny is going to show you how to check your blood pressure. Thank you very much. Thank you.
All right, I want to show you how to use the self-monitoring blood pressure device. I have an Omron device that is approved by a group of folks who review the different types of equipment. And as I said before, if there are any of you that had some difficulty obtaining one of these with your current insurance, please let me know, as I do have these available. So as we review what Dr. Merja said in terms of taking your blood pressure, you should do that a couple times a day. You should use the bathroom before taking your blood pressure, and you need to sit in a firm chair with your feet flat on the floor. You want to do this on your bare skin. Given that it felt like winter today, I did wear long sleeves. I'll get my sleeve up as high as I can. You want to make sure that you've plugged in the machine correctly. The device or the tubing goes into the actual machine. The tubing should come out the bottom when you're putting the cuff on your arm. And this takes some practice when you're doing it by yourself. So give yourself some time as you get it on there and then wrap it around to secure it. It goes above the bend in the elbow, and the tubing should be placed in the center of your arm. Your arm should be placed on a table at a height that's close to your heart, as well as your chest, and should relax. Important that you kind of avoid activity for the 30 minutes prior to using your self-monitoring device, and that you then record it. So once you start the device, you'll want to be quiet. You would wait for it to complete, and then you would record that information. So there are options that you can find on the internet But we also have a card that we distribute. Some of you may have seen these in primary care practices that we distributed earlier. And I will be offering some blood pressure screenings at the senior center once a month on the third Wednesday from 10:30 to 12. And on the back of the form, we included Dr. Merz's information in terms of the different categories of hypertension, as well as a place to record all of the readings, both systolic, diastolic, and then your pulse. So important to record that, and important then to bring that information with you when you go in to have your cardiology appointments, so that they can compare the results that you've had at home with the results that they are getting in the office. They'll see the results of your dietary lifestyle modifications as well as the medication results. You can also bring the machine if there's any questions, so that they can compare the readings that they're getting as well as the readings that you're getting to see if they are consistent. All right, I think that wraps up the demonstration. Our next workshop will be on the use of these self-monitoring devices at home. So are there any other questions as we get ready to sign off tonight? You can unmute yourself with your hand.
Just a quick question. Like you said, having the home blood pressure monitoring device at home, does it need to be actually like calibrated or checked every year?
It depends on the instructions that you receive. I think a good way to check that, though, is to bring it with you to the physician office to make sure that you're getting consistent readings.
Mm-hmm. Okay.
Some devices tend to run a little higher than the actual old-fashioned cuff that may be used in the office. But again, a good check to see how consistent they are.
Very good. Thank you.
Anybody else? Well, again, thank you for joining us tonight. We hope to see you in a couple of weeks when we have a workshop on using these at home. There'll be some more in-depth conversation about that. A reminder to complete the pre-diabetes risk assessment as well as the evaluation form. And once those are received, at the conclusion of all the workshops, the gift cards will be awarded.